So today we are going to do some gentle core strength work. Everything today will be down on the floor, mostly lying down on your back. Feel free to grab a cushion or a pillow if you think you might need it, maybe have them nearby. We're going to start in any comfortable seated or kneeling or even standing if you prefer position. I'm just going to start by taking some deep breaths in through nose, out through mouth. You're welcome to place the hands on the side or front of the rib cage if you want to. Find some length in the spine, so you don't want to be all curled up here. We're just going to think of elongating, lengthening through the torso and the back. Take a big breath. And then let it all go. We're just staying here for 5. Remember your option here. And 3, 2, and last one. Relax the arms just either on the body or by the side. We're going to keep that length in the body. Take a big breath. I'm just going to start drawing the shoulders up to the ears and then right back, as if you're tucking your shoulders into your back pockets. You don't want to create too much tension here, it's fairly gentle. However, you can make it a little bit bigger either by bending the arms or for anybody that wants to, straight arm circles instead. So you've got the choice of 3 there. I'm going to go for the middle one. I'm just going to go 4, 3, 2, and last time. And from there, bringing the hands into a prayer position, or if you prefer, you can cross your arms over your chest, keeping the length in the back. Take a breath. I'm just going to turn to one side on the breath out. Trying to stay still and steady through the hips and the pelvis, so you don't want to be kind of rocking over into it. That applies whether you're standing or kneeling as well. If you've got anything like slipping rib syndrome, Ehlers Danlos that affects around the torso, diaphragm resection, which is something I've had, you might want to make the twist quite small to about here, for example, instead of going too far around. So just find your own range of movement. And we're just going to go for 3, 2, and 1. And then bringing arms to the side of the body. This again can be done from kneeling, and either keeping them at the side of the body, or you can take one arm up and over, or have a bent arm if you prefer. Again, I'm going to take the middle option from here, lengthen up into the back, take your breath, and we're just going to find that length for this side of the body. Don't go so far that you're lifting your sit bones. You want to stay with your legs or your bum planted. Here. I'm going to work side to side. So remember, you can have arm right overhead if you prefer. And again, just work into a range of movement that feels comfortable for you. You can make it really small, such as this. You don't want to force it into a big stretch if it doesn't feel good. We're just going to take 4 more, so 2 each side. And 2. And all I want you to do from there, before we come to the floor, you can close your eyes if you want to, is just gently drop chin down to the chest. You can either keep it just up and down like this. If you want to make it a bit bigger, you could keep the chin down and just slowly rock the head side to side, just introducing a tiny bit of warming up and movement through your neck. So if it doesn't feel good taking it side to side, maybe just come through the middle, facing forwards and dropping down. Being really careful if you're prone to anything like vertigo, dizziness, POTS even. So just whatever range of movement suits you there for a couple more. And then in your own time, we are going to come to lying on the floor. Lying on your back, feel free to grab a pillow or a couple of cushions if you think that might make you a little bit more comfortable. And when you're ready, we're going to come down to the floor. Okay, so from the floor, feel free to pop a pillow or a cushion under the head if you want to. You can always put the tiniest bit of extra cushioning under the lower back if that's uncomfortable for you. I would usually recommend you use more of a rolled up towel than a big pillow under the back, because you don't want it to kind of create a big arch into your spine. So from there, all we're going to do to start with is have the legs bent, placing the fingers lightly on the top of the hips or at the side of the hips if you prefer. Imagine you've got a bowl of water sat on your belly, and we're just tipping that imaginary bowl of water, tilting the pelvis slightly. For you, those of you with endometriosis, adenomyosis, any sort of chronic pelvic conditions, you might want to make this really tiny. There can be a lot of scarring and discomfort through the pelvis, so just really gently sort of tilting through this shape here, as if you're just ever so slightly pushing the lower back into the floor and then just releasing it slightly. Be careful you don't again create a big arch into the lower back. So it's very, very small, just rocking the pelvis back and forward. I'll place my hands here so you can see this shape and this movement as it rolls. I'm just going to take about 3. 2. And on the last one, just finding a place that the back feels a little bit sort of halfway between the two. It's not too pushed down into the floor, it's not too arched away from the mat. So somewhere that feels comfortable, do place a towel underneath if you need it. You can place your hands anywhere you're comfortable, side of the body, on the hips, cross over the chest if you need to. We're going to be alternating left and right. I want you to just ever so slightly engage your core by imagine you just slightly drawing behind the belly button down to the floor. I'm going to start with the right leg, just picking it up, so got a little bit of space under that right heel. Keeping it low, extending it long without the pelvis kind of rocking all over the place. And then drawing it back. Simple as that. Big breath. We swap legs. So I'm going to be repeating this movement in a couple of different variations. If the others get too difficult, you can always come back to this. So you're looking to go fairly steady with your pace. You're not creating this instability through the pelvis. You're nice and level around the core. And we're hopefully not putting too much strain around that pelvic area. You're just going to take another 4, 2 more each leg. Big breath. And last couple. And then final one. Have a moment to pause. You can rock the knees side to side on purpose here. Hug them in for a moment if that feels quite nice. I'm just going to scoot up ever so slightly, so I've got a little bit more room behind me. I'm going to repeat the same movement through the legs. Again, you can do it exactly the same way as you've just done. I'm going to add in moving the arms. So as I extend the right leg, the left arm is going to go with. Takes a little bit of concentration, this. We go from here, we breathe out. Control it back. Pause, take a breath. We swap. Left leg, right arm. Well, I like moves like this because it gives you kind of what we call cross-sectional, across the body stability. And it's up to you really how far back you take that lifting arm. If you're hypermobile, you have air loss, Dan loss affecting your shoulders, you might want to keep the range of movement fairly small. Certainly don't want to place any risk of dislocating or aggravating any shoulder pain or shoulder injuries. I'm going to take just 3, 2, and 1. And then bringing the arms just to the side of the body or hands on the hips if you prefer. We're going to go back to exercise 1 with just the legs. We're going to give you a couple of options here. So you can either repeat how we were, just starting from here. We are going to now stay on the same leg. So left leg is still, right leg is the only one moving, and we're here. If you feel like you can take ever so slightly more pressure, you could either, instead of having the left leg down, have it lifted, if I move that leg out the way, into what we call the tabletop position, about a 90-degree bend in the knee, or have it tabletop but give a little bit of support from that left arm. So it's lifted for a little bit more core work, but it does have some support so the weight and pressure in the core doesn't feel so heavy. So we go long in the right leg. We tap it back. Remember that left foot, can be down as well. Priority is staying fairly stable through the pelvis, so it's not rocking side to side. And the only thing moving is that right leg. Now I take about 3. Now be careful if you're going for a tabletop position in the left, that you don't start creating a huge arch into your back. So you want to stay fairly neutral like we did before. Last one, we're going to swap legs. So you decide, only thing moving is going to be the left leg. You decide where you want your right leg. Remember your choices. Right leg can be down, right leg can be lifted and supported, or unsupported. So I'm going to transfer to here. Remember, if you've got that right leg lifted, you don't want to start arching and bending into your back. We've got 5, 4, 3, 2, and last one. And just have a moment to rest. Hook one knee in, hook both knees in, have a little rock side to side. When you are ready, when you are ready, I'm going to come back to the feet being flat on the floor, legs are bent. I'm just going to reposition into those pelvic tilts, that kind of rock or imaginary bowl of water, tipping that forwards and back. Again, you can make this super, super small if you want to, if it doesn't feel too good around the pelvis. And you can either stay with just this, or if it feels okay for you, I want you to take a big breath. You may prefer your heels quite close to your bum. You may even prefer a cushion between the legs, just to give you some stability and something to squeeze into slightly. We rock that imaginary bowl of water, we tilt the pelvis, and we slowly start peeling the spine, one vertebrae at a time, away from the mat. Just ever so slightly sort of squeezing through the back of the legs towards the bum, and then unravelling. So please be careful you don't just sink straight back down. I want you to think of coming from the shoulder blades to the mid-back, connect the lower back, and then the bum last. Take a big breath. Breathe out to lift. And then breathe in to lower. You can add, if you want to, a float of the arms, or you can just keep them where they are. We're just going to take 4 here. Remember, you do not have to lift away from the mat. You can always stay with just those little pelvic tilts, especially if you're not feeling too good around the pelvis and the lower back. Couple more here. And this last one, I'm going to see if you can pause, even if you're just doing, that little pelvic tilt. You're just going to try and pause in any position. So here, where you can have your back down if you want to. If you pay attention to my feet for a second, I'm going to see if you can either lift one heel alternate other heel, or if you're feeling brave and it's not causing you any leg pain, both heels together. Remember the arms can be down here. Remember your back can be down. So alternating heel lifts from a lifted position, from a floor position, with arms lifted or arms down. A few variations there. And we're just going to stay there for 4. So if you're alternating, 2 more each leg. 3, 2. Final time. This time I want you to roll all the way down. Pause for a moment. Again, hug one knee in, hug both knees in. Have a little rock side to side, whatever feels good at that point. We are going to stay down on the floor in this position just for 2 more exercises. I'm going to go back to moving just the right leg. Okay? So find your little pelvic tilt, forwards and back. Find a halfway point so you're not too squashed into the floor and you're certainly not arching into the back. We're going to aim to get that right leg fairly straight. Now your straight might be a bend in the knee. It might be straighter than mine. For anybody with hypermobility, just be really careful you're not fully locking the knee in position, okay? So a tiny bit of softness around the knee joint. I'm just going to leave the foot relaxed, whatever feels comfortable, so you might have your toes more pointed or not. Alrighty, I'm going to take a drop down. Take a breath in as it drops. You can go as low as you're comfortable, start small, and then draw it back. Now every time your leg is lifting back up, I want you to imagine the belly button is just drawing down towards the floor slightly as the leg lifts now. Now again, you've got options with this left leg, the non-working leg. It might be flat and bent like I have. You could try it straight. And again, if anyone's feeling brave, you could try it lifted. So we're still staying just on this right leg moving, dropping to as far as you feel comfortable. And the lower you drop, the harder you're going to have to work in your core to keep your back connected. Let's go for about 4. If it starts getting too much, you know to keep that left leg down. 2 left. Last one, we're going to change sides by placing the right leg down, lifting the left. Remember it's straight, but not the knee is not locked. And if it's really tight, you might have more of a bend in the knee than I have. It drops down, you take a breath. The lower you go, the harder it is. Draw the belly button slightly towards the floor as you lift. I want you to make sure you're not holding your breath. You've got good breath, so we breathe out and lift. Remember your options with this right leg. 6 to go. And 4, 3, 2, and 1. And from there, bringing both legs down to the floor and lengthening them out. Now if it's having them long causes you any back pain, what you might want to do is just tuck a pillow or a cushion underneath the knees, and it sometimes just alleviates a little bit of pressure from the back. So from there, be careful you're not starting with a big arch in the lower back, so think of your imaginary bowl of water on the pelvis. We're just tipping it ever so slightly, so you've got the tiniest bit of connection through here, nothing too heavy. I'm going to have the arms here. For anybody that suffers with vertigo, or sometimes even POTS can be affected by this, please just rest this exercise out and have a stretch instead by bringing the knees over to one side for 10 seconds and then the other side. So as an alternative exercise, just be careful. Arms to here. Please don't let the shoulders lift away from the mat. Take a big breath. I want you to imagine that you're drawing your rib cage towards your pelvis. We're going to nod the chin to the chest slightly. I'm going to do a little, very slow ab curl, ab prep. It's entirely up to you how high you go. Big breath. Imagine the rib cage is kind of controlled and closed. Now if you really don't like your legs straight, You can go for bent. Just be careful you don't have your feet too close towards your bum. Chin knots, we breathe out and scoop through here. We're just going to take 3 more here. If you're finding this is hitting into your neck straight away, be careful you're not kind of leading up with your neck. I want you to think of almost leading with the ribs. As I said, almost as if the ribs are sliding down. 2. And last one. Then just take a moment to rest. Could just be turning the head side to side. Could be drawing the knee or knees in. Feel free to give ankles and toes a little bit of movement there. When you feel ready, I'm going to ask you to roll onto your right hand side. I'm going to prop up. So I'll let you choose whether you want to be on your wrist or your forearm. Forearm is always my recommendation, so just a little bit more supported. I'm going to stack the hips. Be really careful this top hip isn't kind of rolled back behind and the pelvis is all on level. Hips are stacked, knees are stacked. Feet are stacked. Be careful your feet aren't pulling you right back behind. If anything, the knees ever so slightly forward. And then from there, I'm going to concentrate on this bottom waist. So I'm lying on my right arm. I'm going to allow that right waist, right side of the rib cage, just to drop a little to the floor. Take a breath. And then I want you to create a bit more space here by breathing out and lifting it up. And then it's really up to you whether you stay here with the movement. As an option, you could have that left hand to the ceiling. Or if you want to go further again, as we pull the ribs away from the mat, maybe considering lifting the hips as well. Up to you. Sink the ribs, take a breath. Breathe out, lift or lift. Remember, you can have that left arm wherever suits you best. We've just got 3. Don't have to pick the bum up from the floor. 2. Final 1. And that's it. I'm going to swap sides. So nice and short on the side stuff today. Otherwise it can get a little bit heavy onto the shoulders. So we swapped to being on your left forearm or wrist if you desperately want to. Stack the hips, stack the knees, make sure the feet aren't behind you. Whatever you want to do with this right arm, if you need to, it can be here. Let the left side of the ribs come to the floor. Take a breath. Create more space under that left rib cage. And choose where you want to be. Could be here, could be here, could be here. I'm just going to go for 5, 4, 3, 2, and last one. And then when you're ready, I'm just going to ask you to bring yourself back upright completely, just for a couple of really gentle stretches. I'm going to start with the legs bent. Let the feet come towards each other. It might even be the soles of the feet come together. And we're just going to take a slight lean forwards. You can have your hands on the floor if you want to. If you can't feel a bit of a stretch around the groin, around that sort of inner thigh area, you might just need to guide the knees down slightly. You can always have your feet a little bit closer to your bum. Be careful, those of you with hypermobile hips, you don't want to cause any strain there. So be careful you're not kind of going too deep into the stretch. You're just going to stay there for a nice couple of breaths. And then choosing any comfortable seated or kneeling position. Lengthen into the spine like we did before. I'm going to interlock the fingers, palms facing into the body. Drive the arms away. Be careful the elbows don't overextend and lock. If it feels okay for you, you could drop the head down. Reach the arms forward. Should feel a little bit of a stretch across the upper back of the shoulders. Take a big breath when you're ready. And then we're just going to breathe out and roll the shoulders back here. And you come into that side bend we did earlier. You don't have to have a straight arm, you could always have bent arm. Over to one side, hold it there for 5, 4, 3, 2, 1. Take a breath, swap it over, straight arm, bent arm, whatever you prefer. For 5, 4, 3, 2, 1. Back through the middle. I'm going to come back to just gentle movements into the neck. Close your eyes if you want to, really slowly over one shoulder. Make the transition to the other side really slow as well, just so you don't make yourself dizzy. One more each way. And then from there, just give your shoulders a gentle roll, your wrists a gentle roll, any other stretches you like, and we are all finished for today. Fingers crossed to you. Don't feel too bad for doing that, and it's just giving you a gentle, tiny little bit of core strength work.